This is the ECG of a 56-year-old man who presents to the emergency room after a syncopal episode. Let's have a look at the ECG. Looking for P waves, in the rhythm strips, we can see in both the V1 lead and the lead 2 lead quite easily that there are regular P waves occurring. Some are hidden inside the QRS complexes. We can see that the atrial rate is about 80 beats per minute. If we examine the P waves more closely, we can see that they are positive in lead 1 and positive in AVF, suggesting that they are coming from the sinus node. The P wave morphology is normal in the inferior leads and in lead V1, so there is no evidence of left or right atrial enlargement. The question is the QRS complex related to the atrial rhythm? In this case, they are not. The QRS complexes are regular and completely unrelated to what's happening in the atrium. The PR interval has no distinct pattern to it. The QRS complexes are marching through the P waves. This is an example of complete heart block with a ventricular escape rate of 50 beats per minute. The next question is, where are the QRS complexes coming from? Because they are narrow, they are likely coming from the junction, which is the upper part of the His-Purkinje system. In this situation, because ventricular conduction is normal, we can still use the QRS complex to assess for hypertrophy and infarction. So looking at the QRS complex, the axis is positive in lead 1 and negative in AVF, suggesting a leftward, slightly superior axis. Because it is positive in lead 2, it is not truly left axis deviation, and so this is probably still a normal axis. Because the QRS complex is sharp and narrow, there is no evidence of any intraventricular conduction delay. The voltage of the QRS in the limb leads and in the precordial leads is normal, with a normal axis, and thus there is no left or right ventricular hypertrophy. Here there are no abnormal Q waves, and there is normal R wave progression from V1 to V3, suggesting no evidence of infarction. The ST segments are normal, and there is a normal pattern of T waves in the limb leads and in the precordial leads, showing a normal pattern of repolarization. Overall, this ECG shows normal sinus rhythm with complete heart block and a junctional escape with a ventricular rate of 50 beats per minute. This patient will require pacemaker implantation.